the health center, Grace Yakobe, says 12 out of every 100 expectant women in Mangomba village, Blantyre district, deliver their children at home. Yakobe described these statistics as alarming, noting that many women die from preventable childbirth complications. She made the remarks during a maternity open day held at Mangomba in collaboration with Kamuzu College of Health Sciences and Seed Global Health. Yakobo explains.
Out of 100 women, 12 women would deliver at home, which is an alarming figure. We want every woman to be attended by a skilled, healthy attendant at the hospital because we want to prevent the complications that do arise due to childbirth.
Seed Global Health Deputy Country Director Pacharo Machere says their mission is to expand access to quality care and improve health outcomes, which is why they are involved in this partnership.
As Seed Global Health, our main focus is really to strengthen the health systems by supporting the government to produce quality healthcare workers, including nurses and midwives. And through this partnership, which is tripartite in nature, we have KUHES, Blantyre DHO, Limbe Health Center, and Seed Global Health. So basically, our aim is to make Limbe Health Center a facility which is, we're calling it the maternity-led ward, because we're improving the services there for it to be women-centered and also to improve the learning environment for students that are passing through.
Retired Malawi Defense Force Commander General Vincent Nundwe will be the first ambassador to head the Malawi Embassy in Morocco after the Public Appointments Committee, PAC, confirmed him as ambassador. Malawi officially inaugurated the Embassy of the Republic of Malawi in Rabat, Kingdom of Morocco, on December 18, 2023. PAC chairperson Joyce Chitsulo said Nundwe received unanimous vote following the qualifications and experience he showed the committee. Kathy Maulidi speaks to Chitsulo.
They wanted to learn from him the vision he has for Malawi in terms of the relationship between Morocco and Malawi as regards to what Malawi is going to benefit through this relationship in terms of trade, like education, agriculture, and the other important sectors like tourism as well. So having listened, interacted to him, we felt that as a community he's the right person to go and represent Malawians in Morocco.
The Mzimba North District Social Welfare Office has said there is need to put focus on early years of education, just as it has done with primary, secondary, and tertiary education. Officials believe this is key to improving education standards in the country. The office observes that many parents neglect sending children to early childhood development centers, which are anchors of education. More in this report by Patience Lunda.
Goodwill Karimanjira, a social worker at Mzimba North Social Welfare Office, made the remarks during a 10-year anniversary celebration and graduation of preschool learners at God's Favor Nursery and Junior Primary School in Karabe District. Karimanjira said ECD centers take a holistic approach in teaching learners, which is why they should be given equal priority, just like the other levels of education. He added that having more ECD centers helps the government in provision of quality education to learners and in turn contribute to human capital development as stipulated in the Malawi 2063. He also commended God's Favor School for assisting about 100 less privileged children with free education, saying this is one way other stakeholders can help develop education in the country.
It's a holistic approach sort of education. That means we don't focus at the education only, or we don't focus at the teaching a learner only, but also in a holistic manner where we teach morals.
God's Favor Nursery and Junior Primary School Administrator Steve Banda said the 10 years journey of providing education has highlighted to them the importance of coordination among stakeholders. Banda stressed on the need for private schools to work hand in hand with public schools because they all aim at providing quality education.
It has been up and down, and the world sometimes it won't be smooth all the time. It's a business. It can grow, sometimes it goes down, but we trust in the Lord.
The school was established in 2014 and has an enrollment of 202 learners.
The Malawi Law Commission says more law enforcers in the country do not follow proper procedures when enforcing laws. The Law Commissioner, Rosemeleka Mitonyo Kanyuka, said this when members of the Commission appeared before the Legal Affairs Committee of Parliament to provide an update on the review of the log and vagabond law. More in this report by Mese Matonga.
Speaking after appearing before the committee, Kanyuka said that sometimes law enforcers apply the law differently and unconstitutionally, making the law appear flawed.
Mostly, there's nothing wrong with the law, and the laws shall always be there because we need to be regulated, for everybody, be it law enforcers and the citizenry. We are all supposed to abide by the law.
On his part, Legal Affairs Committee of Parliament Chairperson Peter Dimba said that Parliamentary Committee invited the Law Commission as it is mandated to review and make recommendations relating to the review of the law.
If you're found, just loitering around, you could be arrested, for simply doing that. And we feel, even as a committee, we agree with the court, both the Constitutional Court and the High Court. This is not really something that we should be doing in this democratic dispensation.
In July 2022, High Court Judge Zomwe Ntaba ruled that Section 184 is unconstitutional and asked for a judicial review within 24 months.
Experts have said that the country can make strides in effective waste management if it adopts a circular economy system. The circular economy is a system where products and materials are recycled as long as possible. Environmentalists met in Blantyre to discuss waste management during a meeting that was organized by Waste Advisors. Programs manager at Waste Advisors, Estera Jere, said that the organization is working at forming a national network to bring change on waste management in the country. She explains.
So the main challenge that we're trying to address through this national network is to bring in collaborative efforts to amplify the voices. One stakeholder cannot achieve, it will take long for them to bring change. But to drive sustainable change, we need collective efforts. And this platform is bringing in collaboration of these players to bring in the voices on how we can bring change in governance, the policies, contributing towards environmental sustainability, social and economic development. I would say circular economy is vague. Currently in Malawi, what we're practicing is linear economy, and circular economy will take a while because it requires also behavior change from the grassroots level. This includes the public have to understand what mainly is circular economy. So we are getting there. There are different stakeholders and players who are already doing a lot in circular economy.
Blantyre City Council's Director of Health and Social Services, Samden Seunda, said linear mode of waste management is costly, hence the need to shift to a circular economy.
Currently, and all along, we've been handling in what we call a linear model of approach. Where linear I mean collecting waste, taking it to the dump site, disposing it. So all along, that's how we've been doing it. Though at the moment it seems that it's not being sustainable because it requires a lot of resources, both in terms of machinery, vehicles, labor, fuel. So it's quite expensive to continue doing that kind of approach. Currently, we want to promote integrated waste management and the circular economy, where waste should not be seen as waste, but useful maybe for other uses. As we are talking now, studies have shown that more than 80% of the waste that is generated in the city is organic. So that way it can be converted to other products. One of them could be compost. Currently, we've seen that a number of initiatives are happening.
Hospitals are supposed to offer hope and relief to patients, with some in critical conditions and almost facing death. But anxiety and fear quickly take over with the poor state of most Malawian public hospitals that are still grappling with erratic funding and shortage of space. In this special report, Mese Matonga travels to Rumpi District Hospital, where patients and guardians endure poor diet and battle for space, dumping others to the cold floors.
On this trip, I joined some members of Parliament inspecting healthy facilities. This is under the Healthy Governance project that AMREF, a non-profit organization, is implementing. We further gather that the hospital receives a monthly allocation of 34 million. This buys drugs and essential supplies. It pays utility bills and others. A accrual of 3.5 million only is the food budget.
Let me agree with the findings that really we have challenges, space, food, as well medical supplies and medicines. It's very true.
Congestion is another challenge haunting the facility. Patients are forced to share beds regardless of their status. Some are battling with malaria, others tuberculosis, and yet some women are pregnant. Such a dire situation. We are in a female ward. This was initially designed to house 25 beds, but there are over 45 now. A nurse tells us majority of the patients sleep on the floor sometimes.
There are a lot of challenges at this hospital. As you can see, our hospital is small. This ward is for sick women, but different illnesses are mixed.
With 45 patients being admitted to the ward, the room doubles its population to 90, as every patient comes with a guardian. All these people use one toilet. They include men who are looking after their wives, inviting a sanitation threat.
Women who have gone through miscarriage are also kept in this ward. We need government to take a role, help us build a big hospital so that these women should be separated.
Nzimba District Hospital and Mbeera District Council is trapped in a similar predicament. However, some think they are better off. Director for Healthy Services from Mbeera District Council, Dr. Prince Chirwa, says here too, patients eat beans and nsima every day except on Christmas Day.
In terms of frequency, yes, but in terms of the actual content, in terms of 6 food groups, not necessarily. As a hospital, we would have loved if we were able to provide food containing the 6 food groups, but because of resource constraints, we are only able to do what we can afford with the kind of resources that we have.
Minister of Health Principal Secretary Sam Ndolo pledged to comment on the food situation but failed to do so. Malawi Health Equity Network, Mahin Executive Director George Jobe, laments the situation in the 2 facilities.
It is not appropriate to mix patients with different health conditions because one can get infected right in the hospital.
Commenting on the issue, Vice Chairperson for the Parliamentary Committee on Health, Yulita Valeta, says the 2 are exposed the challenges worsened by poor funding.
Government is not failing, but because of high prices of food items, as you know, these days, maybe every week, food prices are going up. So with the budget, with the funding they are receiving, they fund that they plan that money may end the whole year. but in practical, maybe after 6 months, all the funds are gone.
The country is yet to meet the Abuja Declaration, which compels African governments to at least allocate 15% of their national budgets to improve health care.
You're watching news on Times TV. We'll be back shortly after the break.
Mild sunny days. Parapain Baby swoops in, specially formulated to chase away pain and bring back the smiles. Uniquely developed so that it doesn't contain a drop of salicylic acid, ensuring the safety of our children. Whether it's fever, teething discomfort, or tummy troubles, our hero is on the case, ensuring your little one feels better, faster, with a taste kids love. But remember, it's not a sweet. Parapain Baby is designed for easy intake, chewed or dissolved. Brought to you by Mwai Pharma. Parapain Baby. Tough on fever, gentle on tummies.
Commission for Science and Technology has introduced an online portal aimed at promoting innovation in the country. The Commission's acting director of technology transfer, Isaac Chingota, told stakeholders in Blantyre that the initiative aims at connecting researchers and innovators with possible funders. Chingota explains.
Yeah, and in 2021 we did a survey where we're looking at the environment for commercializing innovations in Malawi. So when we're doing that, we realized that there's a broken linkage between the industry and the researchers and the innovators on the other side. The researchers and the innovators, they produce innovative solutions or products, but they lack the off-takers of those solutions. And then when we interface with the industry players, they were saying that, okay, we have the problems here, but we don't know where to get the researchers, we don't know where to get the innovators who can provide solutions. So as you could read through, for example, Malawi 2063 under industrialization pillar, it says that our industrialization shall be propelled by research, science, technology and innovation.
A researcher at Malawi University of Science and Technology, Tabitha Chigwe, said researchers and innovators stand to benefit from the initiative.
So as Mass Science and Technology, as you know, we are excited about this because innovation is very key for development, for economic growth. So if NCST is working on a portal that will help to connect innovators, funders, and even companies that maybe might need innovations, I think that's a very good initiative. It's timely, and there's a lot that can be done within the portal. So yeah, so it's going to help in many ways, both the innovators, the companies, and even researchers. So I think in general, I would say it's an exciting initiative and timely initiative.
Independent Schools Association of Malawi President Wycliffe Chimwendo has stressed the need for parents to monitor their children as they go on holiday. He made the call at a closing ceremony of the 2023-2024 academic year at Blantyre Baptist Christian School. Gift Sitima has more details in this report, read by Isaac Salima.
Chimwendo, who was the guest of honor at the event, reminded parents not to neglect their role in guiding their children, especially during school breaks.
Parents have to know that sending children to school isn't taking them out of their responsibilities. They are responsible to provide guidance, provide, parental care to the learners or to the children. So it's high time that the children are now coming back home. They should prepare for them and have time for them, and they should also have time to listen the feelings of the children.
Mark Adams Ndorovu, who is principal of Blantyre Baptist Christian School, advised learners to avoid bad behaviors during the holiday.
We're closing today, and we're going to have almost a 7 weeks break, and indeed it is a long period to these young ones. My message is that they should not forget that there are still students. They need to be looking forward to the next academic year, and they need to be at home, but they do not forget their books completely. And actually they should also refrain from these watching channels which maybe they not be very beneficial to their lives.
During the event, the school awarded some of the best performing students, and the school is expected to open the 2024-2025 academic year on September 16 this year.
That's the news for now, but before we go, the headlines again. 12% of pregnant women at a certain village in Blantyre deliver at home. Public Accounts Committee confirms former Malawi Defense Force Commander General Vincent Nundwe ambassador in Morocco. In our special report, Mese Matonga exposed unending poor diet and space challenges haunting public hospitals in Malawi. I'm Matilda Majawa. Have a lovely night.